Hello, everyone. All righty, so let's get started. All right, dental assistants, we are going to go over some questions on Kahoots. Let me hide my answers. All right. So this questionnaire, we're going to talk about dental instruments. So, you know, in the lab, we go over a lot of different instruments, identifying them. First, we go through the phase of what? Learning the instrument. And then once we learn what it is, then we focus on the functions and why we actually use the instrument, okay? So today is going to be a questionnaire. Some instruments may be familiar, some may not. It's okay. It's a learning process for you guys. Some of you are vets in this class, so I do expect you to know a lot, okay? All right, so first question states, let me move this out the way. Move you guys over here. All right, so first question states, this particular instrument is provided in an indirect vision and it reflects the light. You can also use it to retract the lip, cheek, and tongue. Anybody knows what instrument
Your
it is?
mouth mirror.
Let's see, mouth mirror. You're correct. All right. Your next one says, it's an instrument with the interceptual mark that measures the periodontal pockets.
Is it a periodontal probe?
Yes, very good. Let's see. It actually kind of gave you a picture, if you can see right here. Can everybody see that?
Mm-hmm.
Yeah?
Yeah.
Okay, so remember with that probe, what we do, these little
Measure.
black bullets is our ruler that measures those pockets, okay? All right, the next one says, all of the following instruments, all of the following are in the basic tray. So what are some instruments that's on our basic tray?
So we got the
Mouth
mouth
mirror,
mirror,
HBE,
Explorer,
pliers,
HBE,
HBE, saliva
syringe,
ejector,
syringe cap, capping device.
air water tip, syringe.
Yes, all those things. So let's see what options they give us. So Explorer, cotton forceps, 2x2, and your topical anesthetic. So why is that one particular not part of the basic setup?
Because not for every procedure you're gonna need it.
Yeah, you don't
Right.
need it for every procedure. Is what she just said.
Thanks, Tony.
Right, so your topical anesthesia is what? What exactly is that?
It's to numb it. It's like there's different types, right? Isn't the one where you
To
take
numb it.
the cotton tip on and you dry your gingival margin, and then you put the topical anesthetic on there and you leave it on for like what, a minute?
Yes, Tony. Oh my goodness. So good. So yes, so the topical is actually a little cream that, you remember, when this is always on a lot of our procedures we go over, we dry the gingival margin, right? And then we apply the topical and we let it sit on that particular part of the gingival margin where we're gonna get that injection, right?
Right.
So that's pretty much what your topical, does it taste good, you guys?
Sometimes.
It does not taste good, Tony.
It tastes like bubble gum.
No.
It's a very bitter bubble gum, I promise. All right, so true or false? Your low speed handpiece is used, let's see how I can put it. It like it says, it does a friction grip. Is that true or false? Or do we even understand what that question is saying?
Say it again.
A fraction of a grip.
Friction grip attachments.
Yeah, so is it like a free-handed handpiece, or do we have to connect it to something for it to work, or?
Has to be connected for it to work.
Okay,
That'd
so,
be true.
It's
so
a
let's see.
mechanical handpiece.
So my question is, can you use a low-speed handpiece to cut like you can use a high-speed handpiece?
No.
No,
No.
so your low-speed handpiece is used for, now it'll cut to a certain extent, but it's more so kind of like a fingernail file where it can kind of give you a little shape, but it wouldn't cut through a decay or cut a tooth down. It just kind of, it's like a rough, it gives a little speed to like a rough fingernail file. You know, if you don't really press really, really hard with that fingernail file, you really don't get a shape, right? So the low speed kind of does the same thing, if that makes sense.
So is it true or false?
Let's see. So it is false. So remember, that grip attachment, there is no grip attachment. When you see grip attachments, meaning like this pin, it has a grip here to help you not like drop the pin. So it's actually connected to our hosts that are on that unit that we use. You guys remember that?
No.
The unit in the lab where we actually connect where the HVE is at, where the air water syringe, we have to screw it on in order to get that water flow and that pressure through the high speed handpiece. Nope.
Oh, okay.
Like it can't be, we can't just pull it out the bag and start using it. We have to connect it to the unit in order for it to work. Hopefully that makes sense. If not, I will definitely show you guys a video on how to use this little handpiece. All right. Moving on. All right, so this is particularly a function. This instrument is used to rinse and dry specific teeth in or the oral cavity, the entire oral cavity.
Air water tip?
Anybody else?
Air and water tip.
Air and water tip. Okay, let's see. Yep, you guys are right. You are absolutely right. So I know, Michael, you're kind of looking like, I don't really know what's what, but
Yeah,
it's going,
like, I don't know.
it's gonna make sense. Just hold tight, okay? It doesn't make sense because you haven't seen the tray just yet, but I promise you it will. Everybody had that first day where they were kind of like, I don't know what the heck I'm looking at. So don't worry, that feeling will pass, I promise, okay?
Okay.
All right, next. This particular instrument that you see in the picture here, it removes large amounts of deposits from the subgingival surfaces. So what is this particular instrument here? First, let's think about this. If you look at the instrument, what tray would it be on? Can you guys see that instrument?
Kinda, not really.
Okay,
Yeah.
how about now?
Yeah, that's better.
It's kind of like a water pick, kind of, but it's not.
You're right. You're on the right track, Michael. What tray would this particularly be on? Would it be on, okay, I'm gonna call some trays. Would it be on the amalgam tray?
No, I don't think it is.
Composite tray?
Yes.
Crown and bridge? Would it be on the Profi tray?
I think it is. Yeah.
If you look at the question, it says it removes large amounts of deposit from the subgingival surfaces. What instrument that we actually use removes large deposits like calculus, any buildup, any tartar?
That electric drill thing.
I'm sorry. Can you repeat the question?
Tony Baloney.
It is not. Hey, wait a minute. I'm trying to like multitask here.
Okay, so it's an instrument that we use to pretty much remove large amounts of deposit. Deposit could be tartar, buildup, it could be calculus, it could be even under the gums. We have to use this instrument to remove those large particles from the teeth.
A
What
carver.
procedure is that on?
Wait.
So remember, we have,
It's like an electric drill, I think, but I don't know the name of it.
okay, you're getting somewhere, Michael. So remember, let me call the trays out. So we have our Profi tray that we use on pretty much cleaning the teeth and giving that patient a clean smile. We have our fillings, amalgam, and composites. We have crown and bridge to give that person that full crown back. We have oral surgery where we're removing teeth.
I'm gonna say crown and bridge. I would take an educated guess
Yeah.
here.
Crown
It's either
and
that
bridge.
or
I would take crown and bridge
Profi tray.
too.
Profi tray.
Okay.
Profi tray.
So I think it is Profi tray, but let's see. It's going to be a sickle scaler. So what tray is the sickle scaler on?
The Profi tray.
Profi.
Tray. So, right. So when we get into moving large amounts of deposit from the, what is the gingival margin? Our gums, right?
Right.
Okay. So if we have large deposits, meaning calculus, buildup, tartar, just all the yuck that's in our teeth. I know that's not an educated word, but we understand what it is, right? That's what we would pretty much use to get those big, large deposits off of the actual gums. Okay, does that make sense?
Yep.
Yeah.
Okay, and if you can see at the options, we definitely wouldn't use a hatchet because we use the hatchet on our oral surgery tray. So that's pulling teeth, right?
Right.
Spoon, that's pretty much, we're using that to remove any decay that would be inside of the tooth, not the gingival margin. And your universal curette somewhat does the same thing as a sickle, but it wouldn't remove any large deposits. All right, moving on. This particular instrument, it's used to maintain stability of a matrix band during, how can I put it, a certain restoration procedure.
Topfelmeyer.
Topfelmeyer. Okay, let's see. Yes. Can you use a matrix band without the Topfelmeyer?
No.
No, you cannot use.
That would be the clear one. That's the
Maillard.
Yeah, you don't need a Topfelmeyer for that one.
So yes, it would be your matrix band. Absolutely, we can't use it. First of all, how will we even get it to stay on the tooth without that Topfelmeyer?
You really couldn't.
So it gives itself away when it says to maintain stability of a matrix band. Okay. So are you guys writing these questions down?
Yes.
Yep.
I'm just taking screenshots.
Okay. Oh, somebody's growling.
That's my
Okay.
sister's dog.
Oh God.
Sounds like
Wait,
somebody.
that's your sister or that's your sister's dog?
I said it was a dog. All right, let's get back on track. This particular instrument, it finishes and smooths interproximal surfaces. First of all, what is interproximal?
In between the teeth.
In between the teeth. So this one, it finishes and smooths interproximal surfaces.
Football burniture.
Anybody else?
It'd be in between the teeth, so that's your little file thing.
Yeah, that's the file.
File. What exactly is a file? Explain that to me.
It's that electric drill thing with the little circle thing on it.
You're talking about the high-speed handpiece?
Yeah.
Okay, let's see.
Mommy's
It's the
in
finishing strip. So finishing strip is on what tray, you guys?
Wait, you said the finishing strip? Either crown and bridge. I think it's crown and bridge. No, composite.
Yeah, composite, and I think amalgam has them too.
Yeah, amalgam does have it too.
Okay, so remember, our finishing strip is when we have that strip and it's kind of it's like sandpaper and we slide it in. It's only actually used on our anterior teeth and we slide it in between and kind of give that tooth the shape in a proximal.
So I would say composite. Would it be composite?
It's composite for sure.
Okay.
Yes, it's composite. All right. Our next one, this instrument, it's used with water. It's cooled ultrasonic tip and it removes calculus.
High speed. I know you can use a high speed handpiece for this, right?
Maybe.
Why you gotta be maybe? Yes or no?
Listen to the question. I mean, read it. It says.
I mean, I know it. I know the answer.
A hint. This is your hint word. Ultrasonic tip. It's on the prophy tray. It's on the prophy tray and it squirts water. Nope. Okay, let's see what it is.
Like a
Your
water
ultrasonic scaler. So remember, we have our ultrasonic machine where we put that scaler inside of that little pin. No?
Yeah.
Hello?
I wasn't too versed on that tray.
Okay. I do have some tray recordings, some tray lectures coming up. So we will go over each one, okay? We left off on the crown and bridge, so we will be going into oral surgery. Okay, but our has anyone had a cleaning with the ultrasonic tip? And it'll look somewhat like a pin, and they will go along your gum lines, and it'll squirt like water out.
Mm-hmm.
Yeah.
Had a teeth cleaning?
Yeah.
Yeah, that's what you would call your ultrasonic scaler. All right. Next one. Any questions so far?
Yeah, is it similar to like a water pick though?
Say that again.
Is it similar to like a water pick?
Yes, it's something like that.
Okay.
Something just like that. That dog is gonna bite one of y'all in 5 seconds. All right, next question. This is on another instrument. It's used to decrease post-cleaning sensitivity, remineralize, and it's also used to pretty much, if there's a carious lesion, meaning like if the tooth was open or some type of sore was in that area.
Dical?
Could be.
Etch.
Could be. But remember, etch is an acid. It's used to dry, remember?
Okay. So, I'm gonna go with micro tipper.
Okay. Anybody else?
So
I know
Okay.
I'm wrong.
Fluoride.
Oh.
Tricky.
I knew that.
So we always we never really actually talk about fluoride to the extent we just know that we get a fluoride treatment during a prophy, and it's to strengthen the teeth, right?
Right.
So fluoride can also be used as a desensitizer, where if you suffer from sensitive teeth and you need something to kind of make your teeth desensitized, like not sensitive, it does have some medicine in there where it helps the teeth calm down, especially when you're eating cold stuff like ice cream, stuff like that. Does anybody have sensitive teeth?
Yeah.
I do.
Yes, I do too. And it's weird. Huh?
Mine is a sometimes thing.
Yeah.
If I drink cold stuff too fast, it feels like my tooth's frozen.
Oh, oof, that hurts. So for me, who eats ice cream?
Me.
I don't like
Kinda.
chew, though.
Ice cream bothers my teeth.
So on the other hand, if my teeth are not sensitive in the front, they're sensitive in the back, right? So if I eat ice cream, I can't just lick ice cream. I have to chew it like a gum or something. I have to chew it like food.
You see, that's like if a person eats ice, I'm gonna be honest, the people that eat ice and like chew ice cream, y'all are the devil, because I cannot see how y'all can do that.
Well, there's some ice creams that have chunks of things in there, so you have to
I
chew.
don't eat it though. I'm so picky when it comes to it. Just give me some plain ice cream with nothing in it. Like I can't.
Yeah.
Well, I mean, even if it's just, vanilla, I still have to, if it's a cone, I have to bite it. I have to chew it. I don't know. It's just I have to chew. I don't know why. But what do? We use our front teeth to cut our meat, right?
True.
And then, but our back teeth are used to mash our food down so we can swallow. Well, I have to cut it, even though there's nothing to cut. I feel like I still have to do that.
Oh wow.
So I don't know. I guess it's a mind thing, a habit. I don't know.
I just bite that thing with whatever tooth
Yeah.
that it wants to bite.
Yeah. So I don't know. Am I an ice chewer? Not really, but lately it's been hot, so that's how I've been getting some water in, chewing
Yeah, it's
ice.
understandable.
All right, the next instrument is used with a burr to cut a cavity or crown prep.
High speed.
High
High
speed,
speed.
yeah, it shows you the picture. All right, so here's
Even
our high
more.
speed, and as you can see right here, there is a burr inside that we would actually use to cut inside of a tooth or cut the crown off. All right. The next one, it says what is used to deliver a composite to the crown prep?
Like a tip.
What was that, Tony?
I don't know, because it was like right there and then I lost it.
Okay.
And we like just like learned this, and I was reading that actually yesterday.
Okay, so remember it says it's used to deliver composite to the crown prep. So remember, we have to take the composite material and put it inside of the crown prep.
Oh, the gun
That
thing.
pasty stuff,
It's
The
what?
gun.
that paste stuff, where they mix together and it makes like a little type of a paste.
Are you talking about the IRM from yesterday? Well, it's not so much an IRM. It's actually with your composite tray, you have, remember, we have a flowable composite and a packable one. Yeah, it doesn't make sense to you just yet, but it will once you see the tray. But let's just see what option it gives us. Yes, composite gun. Someone said that. Who said that?
I did.
Who's
Mackenzie?
I did? Mackenzie?
Yeah. Sorry. Mackenzie did. Sorry.
Okay, good job, Mackenzie.
5
So
points to Mackenzie.
Hey.
remember that little piece of that little pellet we have that has the packable material, in order to get it out, we have to connect it to the composite gun. Okay. Any questions so far?
Nope.
Nope. Okay. Are we getting the questions down? Or are we moving too fast?
No, we're good.
Yeah, we're good.
Good.
Awesome. The next one is true and false. I hate true and false, but I love true and false. Okay, so the corneal angle is used with a slow speed, a slow hand, I can't read, a slow speed hand piece. This angle is used with a slow speed hand piece. True or false?
What's the contra angle first?
Yeah. I don't know what that is.
Gabby is raising her hand. Where are you, Gabby?
Hey, is there any way that we can go back and like re-look at these questions, or can we only like have them now?
You will be able to go back if it, once I post them, you will have these questions. It won't have the
If you have
answer.
Just take a snapshot. All right.
So is it true or false? Do we even know what a contour angle is?
I don't.
No, I don't
No.
either.
Okay. So true. So a contouring angle would be something to the nature of a prophy angle. You know, the prophy angles we use on the prophy tray
Yeah.
to actually polish the tooth. Nope.
Ooh.
I will post that also. Trying to take notes to kind of see. And this helps me learn, you guys, honestly. So we need a prophy angle. And what else? Toppenmeyer. Okay. Are these questions helping you guys any?
Yep, they are.
Yeah.
Good. All right. Oh, this is a good one. Another name for the tongue and cheek retractor.
Ooh.
Another name for a tongue and cheek retractor? A cheek
Okay.
retractor.
First question. What procedure will we mainly have to retract the tongue and the cheek out of the way?
Endo, right?
Could be endo. What else?
Crown and bridge.
Crown and bridge. Yeah. What else?
All of them.
All of them?
I would say all of them.
Pretty much, yeah.
Yeah, because
Okay.
you need the lip out of the way and everything.
I mean, you're
for
gonna
printing.
need your mouth open. You know, for some, I know for sure. I would say endo tray.
Okay.
Okay, wait, Misty, I have a question.
Yes.
With the rubber dam stopper and all that, that's endo, right?
Yes.
Yeah, that's
We can
endo.
yes, we can use the rubber dam on endo. We can actually, if your doctor is really their choice, you can use the rubber dam on any procedure because it's a protective method for the patient.
Right.
But we prefer you'll see it a lot more in the endo tray because remember, we are taking infection out of the tooth, we're removing the nerve, we are, you know, we're using house bleach to cleanse inside of that tooth. It's a lot of little knickknacks, but let's see what it is. Oh, a Minnesota. So
That's weird.
it's just another name that, listen to the question, it's just another name that your doctor may use when we are using a tongue or cheek retractor. So I'll show you a
It's
video.
called Minnesota.
Yeah, Minnesota. You know, like our Hollenbeck, some of your doctors may call it a hockey stick because it's shaped like a hockey stick. So I will post a video on exactly what is a tongue and cheek retractor. I know some of us may know, but some of us may not know. Okay. The next one, will probably be our last one. This particular instrument is used to loosen tooth from periodontal ligaments before extraction. This is easy. Y'all better know this one.
It's those tools. Those,
I know.
I don't want to say pliers, but they kind of look like, you know, they're kind of shaped like that.
Also, I was thinking too, some pliers.
So
There's a name
remember,
for it though.
there is, but
Oh.
remember, listen to this. This is going to help you guys. So you have, when you are extracting teeth, you have an instrument that's used to loosen the tissue around that tooth and the bone. And then you have another instrument that we use to actually pull the tooth out.
Okay. Well, it's not what I
So-
said.
It's from the surgical tray, right? Hold on.
Yes.
Wait, hold on.
So we have one to loosen the bone and we have one to pull. So you guys earlier said it looks like pliers, that particular instrument, that would be your forceps.
Yeah, forceps.
Oh,
And it kind of looks like cuticle nippers.
It goes like this. It does something like this.
Oh.
So we're using it to loosen that tissue. We're using this type of wrist and hand motion. Okay. You could give up?
Yes.
yeah.
Okay. So it would be your elevators, okay? Your straight elevator. Really, all of these elevators here we would actually use to loosen some form of tissue. But when it comes to ligaments, your straight elevator would be the one. We all know what a straight elevator is?
No.
Okay. So we're going to be going over that in our surgical tray. All right.
Yeah, because I think the last day that we were there, we were seeing the instruments, but we didn't really get into the names of like the stuff that messes with the tooth, like the
Right. So well, let me ask you a question. So that was the last question. I'm going to get out of this particular screen. We will pick back up. Hope you guys got the questions down.
Yep.
Let me get out of this. All right. So, question. As far as the instruments, when we go over the instruments, is it better when we actually, I have a picture and it's labeled and I talk
Yes.
about each one? Or
Yes.
is it better if I have the actual video and I'm holding the instrument up?
Mm.
It can be either or. I would
Yeah,
like
as
to
long
pick-
as like it's like, you know, noted like what it is, like in your like to point it
I
out.
think
Like I feel like either way would be fine.
Okay,
Yeah,
because
either
last
way.
time you guys remember whoever attended, I had a picture of the actual instrument and we kind of just went through each one, and I think that went really well. I like to kind of mix it up, either or. I can do both sometimes, and then sometimes I may just do a picture or set it up in the actual lab. So we'll try either one and we'll see what actually works. But I think that'll be great. I'm gonna go ahead and stop recording because that concludes that part, but you guys don't hang up just yet.